Hi, my name's Santino. We're going to do a 2-view chest x-ray. So first I'm going to get the rec from back there, and it's going to give me my name, what I'm going to do, and who the exam's going to be on. So first, what I'll do is I'll set up my technique. We're going to go right over here to our machine. We're going to go to chest PA. We're not going to use AEC. Make sure that's against the wall. We're going to set a manual technique. KV is 120 in this room. Mass, we're going to lower it. They say here 3.2 is the average. We'll go up and down in sizes depending on the size of the person. I am doing a female right now. So I'm going to get a 14 by 17. We're going to put it in the bucket here. I'm going to start, I'll start lengthwise for a female. Normally male, it'll be crosswise. Green dot's going to be on top. Place that there. I put my left marker here first, just so I don't forget it. Get the shielding about right there. Again, just repetition. So we're going to set this to about 72 degrees to reduce magnification and, 72 inches to reduce magnification and increase spatial resolution. I'm going to line it up to the butt, but we're going to detent it. There we go. The tube is already angled at 90 degrees, otherwise I would unclimb it. Now it auto collimates to the size. So this room, otherwise I would have to collimate it. Right now we're good to go. So I'm going to grab my rack, possible gown, and grab my patient. Hello, Jane.
Yes.
Hi, my name's Santino. I'm with the X-ray department. Want to step inside here? Can I just have you confirm your last name and date of birth?
Jennifer Jane, 3/19/1993.
Alrighty. So what brings you here?
Cough and chest pain.
Okay, so what we're going to do is we're going to take a couple images of your lungs. In the meantime, is there any chance you could be pregnant?
No.
No? Okay, so in the meantime, if you could change this gown, if you could just remove all jewelry from the waist up, includes bra, any like chains, whatnot.
Okay.
If you do that, so anytime we're going to wait a few seconds for her to get that done. When she's ready, we'll come back. She's ready to set. Alrighty. So you're all set. If you want to step right here, I'm going to shut the door. And in the meantime, do you have any history of high blood pressure?
No.
Diabetes?
No.
Are you a smoker?
No.
No? Okay. Any surgeries around the chest
back pain,
area,
but-
heart pain, any heart problems?
No.
No? Okay. Gotcha. So what you can do is if you get your chest against there as close as you can, and you separate your feet about shoulder width apart. Go ahead and put your arms good and low here, and then if you roll your shoulders. Alrighty. So what I'm going to do is just slide her hair just off to the side a bit, and then what I'm going to do is I'm going to feel basically the bottom of the scapula, or for the T7 where the central ray is going to go, which is about here. So that is where I'm going to line my tube up to. The other way is you can do the tube first or the bucky. Sometimes I like to line the bucky up first, kind of match the top of the IR to about a little above your shoulder, just to get a good starting point. Once I got the central ray set up, I want to make sure it's aligned with the bucky and the IR a little later. I'm just going to raise that just a bit, sorry. Just watch out for your chin. Okay. And then you want about 1.5 to 2 inches above the shoulder of light right there. So we have our technique set up, her positioning set up. So I'm going to step back here towards the console here, and then I'm going to ask her to, if you can take a deep breath for me. And if you can release, take another deep breath and hold it. Then I'm going to go X-ray, shoot the film. All right. And then you can relax and breathe. I'm gonna pull this up. Just give me a second. I'm gonna run this. So I'm gonna switch. I'm gonna put that in the IR. I'm gonna switch it. Now we're gonna do a lateral because again, she's a female. It's gonna stay exactly the same lengthwise. It's gonna go in there. We usually drop it about 1 inch. Now, if you can look towards me, put your hands above your head here, get as close as you can here. And again, if you could spread your feet about shoulder width apart. So now, the ray is also going to go at the same spot, T7, and at the mid-coronal plane. And what we're going to do is try to get no rotation. How we do that is have the feet about shoulder width apart. We want a little light in the back, and this center line is even, like I said, with the mid-coronal plane or with the ear line. The original one, the PA, was the mid-sagittal line. But so. All right. So as we're separate. All right, so what we're gonna do is, good rule of thumb is doubling the mass. We go about 6.3, again, give or take what the patient's size, but we're gonna stick for this. So what I'm gonna ask you to do is take a deep breath and release, relax. Now take another deep breath and hold it. We're gonna shoot the film, go X-ray. All right, go ahead and breathe. And we're gonna run. Run the IR, make sure I got a good quality image. If that is, we're going to come back here and I'm going to say, we did a good job. We got what we needed. The doctor will be with you soon if they're waiting today. It could be average about 24 to 48 hours.
Okay.
If you're coming back, wait for a response. But they should receive it and they'll contact you shortly.
Okay, thank
That's
you.
it. Yeah, if you want to change, and I'll walk you to the front.
Okay, so now we're going to do an evaluation of a PA chest. So the first thing you're going to look for is proper collimation of a 14 by 17 plate. Then you're going to check for rotation. You want to see if the SC joints or sternoclavicular joints are equal distance from the spinal column. Next, you can see if you have the entire lung field in the image. You want to see everything from the apex or apices down to the costophrenic angles. Next, you're going to see if the scapula, which is right here, if it's outside of the lung field. Patient can do that by rolling their shoulders forward. After that, you're going to look for 10 ribs. So you're going to count down to 10 ribs, and that basically shows that the patient took a nice deep breath. After that, you're going to check out for some anatomy. You want to see this air-filled trachea down to the carina, which breaks out into the hilum. You're going to see if you get, for the spinal column, do the heart shadow. Then you're going to look for the aortic notch. After that, you're going to check out for the diaphragm. There's a stomach, there's a liver. And then after that, you'll look for lung markings. If you have all that, you have a pretty decent chest. And I pulled this up from the internet, so this is actually one of the better chests I've seen. All right, thank you.